Welcome to another segment of Under the Microscope. I'm joined today by Dr. Dele Davies, our Vice Chancellor of Academic Affairs and Dean of the College of Graduate Studies. And I want to talk with Dele today about the Wellness Symposium that's now planned for January 26th and 27th. Dele, thank you so much for being with us today.
Thank you, Chancellor Gold.
As you well know, our initiative is to reduce the outcome and the stigma associated with stress and burnout, depression, mental illness in students and staff and faculty and others on the campus. And I wonder if you could talk with our audience a little bit about the program, about the symposium that we're planning for the end of January.
So this is a symposium that is being led by Dr. Julie Sebastian, who is the Dean of the College of Nursing.
Yep.
And she's got a group of people working with her, including myself. And the goal is to really elevate the conversation concerning mental health on campus. So mental health of our students, our faculty, and our staff, and making sure that people have tools available to them to deal with stress and to manage any kind of emotional distress that may happen while they're doing their day-to-day work.
We've talked with Dean Sebastian and others about our focus on wellness on campus, and specifically on these areas of stress and burnout and depression, and even unfortunately suicide, as the national trends continue to cause emphasis and concern for us and of course across all of academic medicine. Could you tell our audience a little bit about the program that we're planning for the end of the month?
Yes, so this program will occur in January. It'll be January 26th and 27th. We're going to have world-class speakers who are going to come and talk about just different aspects of managing stress and elevating the conversation on our campuses. Mm-hmm. And so we're going to have, for example, Dr. Timothy Bingham, who is with the ACGME, mm-hmm. and he's going to come and just talk about the issues as it relates to residents. We're going to have Dr. Lizalette Derby, who is a world expert in managing stress from the Mayo Clinic. Mm-hmm. And she's also going to talk to us about some of her work and how we can really help our faculty, students, and staff manage stress. And we're going to have somebody from the Benson Herr Institute of Mass General, mm-hmm. Harvard University, Dr. Mehta.
Yes.
And he's also going to, he's really somebody, his whole unit works on basically how to deal with stress. And finally, we're going to have Dr. Velokovic, I believe, if I'm saying the name right. He's a dentist. He's the head of the Dental Association. And they've also been focusing a lot on how to manage mental health amongst dental students and faculty.
So I guess, would you say that this is part of making the campus more aware of calling out the fact that stress is part of the educational process, and that it's not, while it's not anything that we look to cause, it's certainly something we want to identify early when and if it occurs and deal with it proactively?
This is absolutely the case. We really want to elevate the conversation and have people feel comfortable about talking about stress and not waiting until perhaps it's too late to really discuss it. We want people to feel comfortable and understand that at the campus level we really have tools and we have resources available to help. And really our goal is to have a very healthy campus, not just physically but emotionally. And so we want everybody to feel comfortable to reach out and have a conversation, because chances are that somebody else is going through what you're going through.
Absolutely. I know it's very, very common. So if one of our students or one of our faculty or staff has a question either about the program or about all of our programming regarding stress reduction and wellness, who would they contact?
They can contact me, they can contact Dean Sebastian, and we certainly have, for example, we have an app on the UNMC app that deals with students, faculty, staff can actually directly access that to deal with any kind of help that they may need. And we have multiple ways to actually access that help, even on that app. You can access it under the health, you can access it under crisis, distress. There's so many different ways to access that help.
And I understand it can be done in a very, very confidential way.
Absolutely. So you can actually just, if you just want to talk to somebody, there's a line you can call. If you actually want to make a request to meet with someone, then there's that opportunity. And if you want it to all be confidential and just feel like expressing how you're feeling, then you can do that too.
That's great. Well, Dele, thank you so much for being with us today. Thank you for being with us today on this segment of Under the Microscope.